ADHD, as the name says, attention deficit hyperactivity disorder. It's, uh, it's a disorder that is composed of two main things, attention deficit and hyperactivity plus impulsivity. It is very common. It is one of the most common childhood disorders. Now, if you read papers, it's around like 10 to 20%. If you go to our office, maybe ask the people who work there, they might tell you it's even more common than that. So if you think that your kid has ADHD or probable ADHD or any symptoms of ADHD, the first step is to go to your primary care pediatrician or family doctor. It's basically inattention and extreme hyperactivity, and the kid will be very impulsive. Usually, like the most common symptoms are when we take the kid to school, he can't remain in his seat, and the teachers will be always calling the parents, please come pick up the kid. Usually failing at school, poor academic performance. Now, if you want, probably like most children have symptoms of ADHD here and there. Many kids are hyperactive. Many kids have lower attention spans and sometimes impulsive, but not all kids have ADHD. In order to be qualified for diagnosis of ADHD, the symptoms have to be very frequent, very often, and have to be persistent for more than 6 months, and it has to be at 2 or more settings. Like the main setting will be school and probably at home. So if a parent comes and tells me, look, the kid is fine at school and his grades are fine, but at home he's overacting, then probably that's not ADHD. You have to look, is there something going on at home? Or vice versa. The kid is fine at home, but at school he's overacting. Could there be some learning disability going on rather than ADHD? And the other thing with ADHD, usually it starts early in childhood. If you ask a parent how long you've noticed that, they'll tell you, I don't even remember. He's been always like that. So for an older kid to start with these symptoms, like a 12-year above, it's unusual to be ADHD. In order to qualify for ADHD, the main thing is it has to affect school performance and social interaction. If there is no impairment in these, then that's probably not ADHD. To summarize, the treatment is very long and there is a huge list of treatments, but to summarize the treatment in one word, it's medication. Now, you know, many times you go to doctors and they try to treat it in a different way, like do some exercise, diet, stuff like that, and they try avoid medications. But in ADHD, usually medication is the most effective treatment rather than any other intervention. The only exception is usually younger children, preschoolers between 4 to 6, you may try behavioral interventions as a first line. And if that doesn't work, a medication is to be started. The most effective treatments are CNS stimulants. ADHD medications are divided into 2 main groups, CNS stimulants and non-CNS stimulants. CNS stimulants are the most effective ones and that usually work in more than 80% of the time if you got the right diagnosis. It does cause lots of disruption at home and school for the teachers, for the other children, and it does cause lots of distress for the child himself. It ends up, some kids will end up having some other problems. Given all the troubles that they get at, they will have lower self-esteem, sometimes they'll become more anxious, sometimes they go into depression, and these are very frequently seen in kids with ADHD. Like up to 1/3 of these kids will have some degree of depression or anxiety and some other conditions going on. So that's why we tell the parents, if you think your kid has any of these symptoms, just bring the kid to your doctor to get tested. Because if the kid has ADHD, the treatment is very simple. 1 pill will take care of that. And you'll notice a huge difference after 30 to 40 minutes after the first pill. It's just that easy. This is a chronic disorder. It can persist until adulthood. 50% will have it probably lifelong. So it's like diabetes. You have to strictly adhere to your medication. Same thing with ADHD. So you have to take the medication, and many times before you get to the steady state or the maintenance phase of treatment, there are lots of ups and downs. Is this dose good? Does the kid need lower doses? Does the kid need more? Does the kid need additional dose for lunchtime or after school? Till you get to that stage, typically it takes more than 3 to 4 months to get to that phase. Once everything gets to a steady phase, and that's the ideal dose for the kid, and the school performance is fine, teachers are happy, parents are happy, then we typically see them every 3 months after that stage. But before that, there is some work to be done to get to the ideal treatment regimen. Many times parents are concerned about, is there any diet restrictions or limitations for kids with ADHD, or sometimes they tell you, like when he ate red dye, he starts acting out, or like sugars. Now, there are many reports that say that can happen, especially with refined sugars, but all are controversial. Like, there's no clear evidence. Now, one thing that we can do, many parents are very reluctant to start a medication. Sometimes we offer these parents like a short-term elimination diet, like for not more than a month. But as I told you, ADHD is a much more complex disease, multifactorial, that usually a medication will take care of that. We don't fully understand what causes this, but there is strong genetic background. Usually a parent will come and tell you, look, when I was a kid, I used to have lots of inattention, daydreaming and stuff, but during our time, like, no one paid attention for this. As I mentioned, many times there is like a structural brain difference between kids with ADHD and kids with no ADHD. Sometimes their frontal lobes, or even the whole brain volume, is a little bit lesser than kids with no ADHD. Sometimes the area that is responsible for task performance, like inhibition of impulsivity, undesirable emotions, and focusing, it's called the prefrontal area. Sometimes that part in the brain of kids with ADHD is a little bit thinner. And if you go more to the molecular, like inside the brain, there are certain chemicals we call neurotransmitters or catecholamines. These chemicals are not there in an enough quantity in kids with ADHD. That's why we tell parents, sometimes what your kid is doing is not like willfully, like there's something going on. And that's why CNS stimulants, if you got the right diagnosis, CNS stimulants will get these chemicals in your brain up, and that's why after the first pill, kid will be fine. Unless there is something significant else going on, something like major anxiety, a problem, depression, a significant learning disability, a serious conduct disorder going on, sometimes, rarely, a bipolar disorder can present as an ADHD, unless it's just like an ADHD, just a pure ADHD by itself. It responds very well to treatment. Basically, an interview, we just tried to make sure that this kid has no other medical problems that could cause this. Like any other medical interview, just was this kid full-term or preterm? Because prematurity, even like late preterms, like who were born like close to term, 35 or 36 weeks, or sometimes people consider these are like full-term because the kid was fine, never had a problem. These are at very high risk for ADHD, or even like some psychiatric problem later on. Like did the kid have lots of ear infections? Did the kid have like lots of head traumas as a kid? Was there like a neglect, abuse, like all these kind of, and the family history. So just like any other medical encounter in pediatrics, we get a full history and an exam. And then there is a rating scale called the Vanderbilt scale. That's the most commonly used. It's basically a form of questionnaires for a teacher and a parent. We hand it to the parent, they get it filled, and the teacher fills their part. They bring it back, we look at them, and we do kind of a scoring system to. But to be honest with you, this is very common. We see it every day, and sometimes after the first or second minute of the encounter, if it looks like a duck, then it's probably a duck. So